And hi mga arthritis warriors, I'm Dr. Jonathan Flordelis and welcome sa ating hip live. We're answering questions from a combined group. Firstly, we do have a group that is dedicated for hip and knee arthritis. We have the Facebook group. It's free to join the Hip and Knee Arthritis Cebu Facebook group. And you can join it for free and be part of the community. And we try to answer questions from the community. And of course, we have our second group, the AVN Warriors Philippines. This is actually not a group but a chat group po. So it is a messenger chat for patients na may avascular necrosis, osteonecrosis, similar sa mga nakikita nyo sa actress/vlogger Angelica Panganiban na nagkakaroon ng AVN. This has actually boomed in the last few in the last few weeks. AVN numbers have increased, the number of patients have increased, the number of surgeries around the world has also increased with regards to AVN. So, if you can hear me loud and clear, let me know where you are from. So we are going to answer questions about hip osteoarthritis, hip fractures, of course, hip AVN and hip arthritis. Again, I'm Dr. JOF Flordelis. You can call me Dr. Jonathan Flordelis or Dr. JOF. I'm a Cebuano hip and knee specialist at the Cebu Orthopedic Institute. So today, a lot of the patients are asking, Doc, how do I know na meron akong AVN? How do I know na meron akong arthritis? Or if na-fracture po yung hips ko? That's one of the questions. So it's easier to show you. This here is a normal hip. So you can see sa ating hip that this is a normal hip joint and this is a normal bone. Very nice cartilage there. What happens actually in arthritis is a wear and tear is one of the reasons that why hip arthritis happens, and this wear and tear destroys the hip joint. So from a normal hip joint, you will now have a diseased hip joint right here. Nasisira po yung hip joint natin, causing pain sa my groin. So yung true hip pain is actually hindi sa balakang lang, but nasa singit po. So saan yung singit? I'll just stand up. Dito po sa may singit po yung pain. So if you have pain in the groin, pain sa singit, or you have what you call this, sa Bisaya, punuan, sakit sa punuan, it is possible that you may have signs and symptoms of true hip pain, yung nasa ball and socket joint po. Now, if you have diseased cartilage, how will it look on your x-rays, no? So, we're gonna show you an x-ray of a normal hip first. So, ito po yung tinatawag nating normal hip x-ray. So, we have a round head. The joint space is also normal. And there are no signs of arthritis or fracture. That is a normal hip joint. Now, I want you to see the abnormal hip joint na posibleng arthritis. This is an osteoarthritis of the hip. So we're gonna share with you an osteoarthritis of the hip. This is an arthritic hip secondary to something called dysplasia. So yung head is not exactly inside the socket, causing a wear and tear arthritis on this part here of the head. So you will notice normal yung femur, normal yung neck, but when you see the head, it's hitting the bone. It's bone-on-bone arthritis, secondary to something called dysplasia. So this is adult dysplasia. Now I want you to compare the two. Ito yung normal, ito yung abnormal natin. So you can compare. So mga arthritis warriors, that is one of the things na you need to know. On the x-ray, we can actually tell ano yung problema nyo, what type of hip pathology you have. So the x-ray is relatively cheap. It is the first test that we do, aside from, of course, the physical examination, which we do on the bed, no? We have to examine the patients clinically, check the range of motion. Some of the questions that we ask, kaya pa ba maghinambid or dekwatro ng tuhod? Because that can be a sign of hip pathology, hindi na makakasuot ng socks, sapatos, nahihirapan na po mag-dekwatro. those are signs and symptoms. But on the x-ray, yun po yung tinitingnan natin po sa hip na may pathology. So for patients na may fracture, we also have different types of hip fracture. So we'll go into that in a bit. Balik tayo sa actual questions natin sa ating Facebook group. Remember, if you have questions about arthritis, hip AVN, or hip fractures, comment below where you are from and we'll try to get your question in and answer them. So, sa AVN Warriors chat group, dito tayo magsimula sa mga tanong natin. Doc, again, this is from the AVN Warriors chat group. This patient is asking, Doc JOF, good morning po, ano po yung mga markers ng infection? Wow! Markers ng infection. So, if you have an infection, whether it's hip or knee or anywhere in the body, we have a CBC, that is the most cheapest and basic test na ginagawa po natin for infection. Complete blood count will show an elevated na WBC. Medyo technical tayo kasi medyo technical yung tanong. We also check yung tinatawag na blood markers na ESR, erythrocyte sedimentation rate. So the ESR, the CRP, and the CBC are usually what we check in infection. So those are the general markers of infection. But of course, hindi lang po yung CBC, ESR, and CRP. Mga blood tests are one thing. The second thing that we need to check are also yung site natin. If yung infection nasa hip, namamaga po ba? Masakit ba? May nana po ba? Because if you have nana or pus, definitely infected yan, no question. If may sugat tapos may nana, 100% infected, you don't need to rely on different tests sa sa blood tests to know if it's infected. Kasi if may nana na lumalabas tapos may sugat, it means may connection po yung sugat at saka yung yung loob ng katawan po. So, question number 2, Doc, nagkaroon ako ng infection at nilagyan po ng spacer after sa first hip replacement. Oh, wow. So, yung patient natin already had her hip replacement done. It got infected. Tapos, nilagyan siya ng spacer. Doc, ang tanong ko po ay how many months before yung spacer is removed? So, ang spacer is actually a antibiotic na cement, usually nilalagay sa hip joint, no? So, if meron po kayong yung hip replacement po, tapos nagkaka-infection po ito, we actually remove this hip replacement. Tinatanggal po natin yung hip replacement. Tapos, pinapalitan siya ng antibiotic po na ganun pa rin yung mukha. So, the antibiotic is put in and yan po ay yung temporary na hips nyo hanggat mawawala po yung infection. It's not easy to treat infections po. Some patients will require multiple surgeries. So, it's very hard to say how many weeks or months kasi every patient is different. But in an ideal setting, yung pag nakuha yung infection in the first 1 or 2 surgeries, then definitely pwede nating ibalik yung hip replacement para po na may hip joint ulit yung patient. So, we do what we call a 2-stage procedure. Yung first stage is tanggalin. Yung second stage is of course, sa pagtanggal, naglalagay tayo ng antibiotic dito sa buto. And pag okay na po, tinatanggal po natin yung antibiotic. So, tanggal yung antibiotic, tapos ibabalik yung hip replacement po sa ating hips. And that is, of course, hopefully the end of the infection. So, yung infection treatment can be varied. Some will go for 6 weeks, 8 weeks, and sometimes patients suffer for more than 6 months po. Depende talaga sa situation. So, thank you for that question. I hope po na you get better, that your infection improves po. Tapos, next question natin, Doc, maa-alarm po ba ako kung sumasakit yung surgery side? If you had a surgery on the right side, it's normal to have a little bit of pain, a little bit of swelling, especially if you are on yung tinatawag na blood thinners or antiplatelet. So it prevents clotting, but it can cause swelling. It can cause sometimes a little bit of bleeding po. So not every patient is the same, but in general, hip replacements can have a little bit of pain, so you don't need to worry. Is also noting how many weeks po kayo after the surgery. If for about 2-3 weeks, usually the swelling, the pain goes away. Around this time, it also matters what approach was done. Was it from the front? Was it from the sides? Or sa likod po? If a lot of muscles were cut, of course, it'll be a little bit more painful, mas masakit po. Pag konti lang yung tinatanggal na muscle or konti lang yung kinat, or sa anterior approach na no muscles were cut, you will have a faster recovery naman po. So shout out po tayo ni Arleth. Hi Ma'am Arleth or Sir Arleth from Negros Oriental, and Mr. Tolentino, good morning po. Remember guys, message me where you are from before you ask your questions. Itutuloy po natin yung ating question and answer sa ABN Warriors chat group. Very, very specific questions because these are actual patients, real patients all around the Philippines, and they're asking their questions. We try to answer them, of course, pag may time at gusto natin na masagot para matulungan po yun natin mga ABN Warriors natin. Dok, bakit nagkaroon ng infection ang hip? Well, infection, remember, is rare, but when it happens, pwede kasing may mikrobyo or bacteria na nakapasok sa hip joint, and usually yun yung cause ng infection. Paano sila nakapasok? It can be through the blood if you have a ongoing infection, no? So pag may infection kahit sa ngipin or anywhere in the body, or if sa may paa, may tinatawag na infection sa feet or legs, there is what we call a blood na transmission. If may infection anywhere in the body, the blood can bring that bacteria inside yung hip joint and cause yung infection po na kailangan tanggalin yung implant. Yung nangyari po sa inyo is rare, but it does happen. How do we prevent infection? So number one, before any surgery, we do have a clearance na team of internal medicine doctors. We have to have patients who are possibly diabetic or high risk na kailangan natin ipacheck sa ating internal medicine friends para po mag-lessen yung chance of mga complication, and not just infection, heart problems, kidney problems, and some things like infection can be avoided kasi